This presentation is brought to you by Olivia, Annalise and Nicole. The article we have chosen to present is Urine Analysis with Dipstick Test in Asymptomatic 7-year-olds. Globally, urinary tract infections, also known as UTIs, are the cause of approximately 150 million cases each year. The infection can involve either the lower, upper, or both parts of the urethra, potentially causing a bladder or kidney infection. It is also one of the most common types of childhood infections, behind respiratory and gastrointestinal infections, with studies conducted by Razi and Abdinia identifying its reasonable resistance to antimicrobials. UTIs generally have a higher prevalence in females as opposed to males. However, this is not the case within a child's first year of life, where males are generally more susceptible to contracting these infections. Subsequently, the incidence grows reasonably higher for girls, with a 3 to 5% infection rate, as opposed to the 1% for boys. Globally, the incidence in renal failure amongst children is increasing, causing major concern. In regards to the history of this study, previous studies conducted by Hogg and Biljon have investigated both similar focus areas, particularly regarding the cost benefits of preventative screening and the utilization of dipstick testing. Hogg analysed countries with established urinary screening programs for children, specifically in Korea, Taiwan, and Japan. One of the major findings of this study was that a global consensus has not yet been reached, particularly regarding the cost-benefit of the screening process. However, it has been reported that Japan has been able to reduce the risk of progressive kidney failure through the screening of chronic kidney disease in children. Biljon has also identified the practicality in utilizing dipstick tests in the diagnosis of kidney disease and UTIs in children, with failures in initial diagnosis often being the result of how the urine sample was collected. Another study conducted by Kaplan, Springate and Feld sought to determine the minimization of cost in the screening of dipstick urine analysis. This study proposed recommendations of providing singular screenings for asymptomatic children to be obtained around the school entry age of 5 to 6 years old, as opposed to interval screenings over numerous years. This ultimately leads to the reduction of costs by minimizing the number of screenings needed to be analysed. In regards to the gaps of research, a major concern of kidney issues are the asymptomatic clinical symptoms. Due to the difficulty in identifying these symptoms, end-stage renal disease in children could potentially be prevented through the introduction of early diagnosis and interventions of effective treatment. With this being said, screening and prevention planning require more extensive research to be undertaken to improve the overall incidence and prevalence of cases. In order to understand the aims, there are major complications that can arise due to the contraction of urinary infections, which typically involve chronic renal failure, hypertension, scarring in renal tissue, and disorders of the urinary tract. Consequently, to avoid these major complications, timely diagnosis and appropriate treatment is essential, particularly regarding regions of poorer socio-economic conditions, including countries such as Iran, which normally see a greater incidence of kidney disease. The main aim of the study undertaken was to evaluate the analysis of a simple, low-cost but powerful urine detection technique in asymptomatic individuals. This is to hopefully improve the life capacity of children worldwide through appropriate methods which seek to overcome this disease whilst they are still able to do so.
This study was undertaken between 2017 and 2018 on 292 7-year-old children referred to health centres in Naishaba, the city of Iran. The sampling techniques technique used was stratified cluster, comprising only children from a particular school district. Initial clinical examinations were undertaken for height, weight, blood pressure, and temperature. Those suffering from fever, those who had participated in strenuous activities, or were on any form of drugs or supplements were excluded from the sample. For the 250 who progressed, the initial urine sample was taken in the morning, and a dipstick test was performed by immersing a reactive testing strip into the sample. Positive results, seen as a visual colour change indicative of achieving a threshold, were further investigated under a microscope for abnormalities such as red and white blood cells. Results were entered into a software program and analysed with chi-square and Pearson statistical tests on normal distribution. Statistical variables less than 0.05 were considered abnormal and therefore statistically significant. The results concluded that urinary problems were present in 163 children, that is, over half of the conducted study. There was no statistical difference between males and females. Pyuria was the most common complication suffered. Urine pH and specific gravity had a statistically significant relationship, prompting interest into its implications. Early detection is key to preventing the progression of renal disease in an effort to reduce the overall incidence of renal failure. Most kidney diseases are difficult to diagnose as they do not present with any symptoms. Mass screening is a helpful tool to determine its presence in early asymptomatic children. The findings in this study showed that urinary problems were present in 55.82% of the children studied. Hematuria, that is, blood in the urine, was found to be the most common in boys. Pyuria, that is, pus in urine, was found to be the most common in girls. If we ignore sex as a factor, pyuria was found to be the most common overall. Comparatively, proteinuria, that is, increased protein levels in urine, was the least common. In a 2010 cross-sectional study by Hegyessy et al., hematuria was found to be the most common urinary abnormality in primary school students at 1.5% of their sample. This contrasts with the chosen study for this presentation, where pyuria was the most common. In the 2014 study by Al-Hafi et al., hematuria was found to be the least common in Egypt and Nigeria. However, further studies found proteinuria was the most common. The differences in these studies may be due to cultural factors, lack of hygiene, or environmental factors such as water availability or contamination. Comparatively, a study in 2001 by Lin et al. In Taiwan found that only 0.3% of the children studied had abnormal urinary findings. This lower result was strongly influenced by socio-economic factors, which ensured children had accessibility to healthcare and proper nutrition. In a 1998 study by Plata et al., children in Bolivia under the age of 5 years were studied, and 30.3% were found to have abnormal urinary findings. This is dissimilar to the study focused on in this presentation, as the children were of a younger age. However, they produced similar overall results. In summary, the study in this presentation and the studies mentioned in the discussion provided insight into cultural, environmental, hygienic, and socioeconomic factors that increase the prevalence of renal disease. Water contamination and availability was a major contributor to the incidence of disease. The studies mentioned allowed comparison of age and countries to better understand the necessity for early childhood screening. The limitations of this study include the inability to detect false positives and false negatives. Drugs that affect false positives or false negatives were excluded from use by subjects in this experiment. However, these effects are many and varied, so conclusions should be based on further tests.
As a result, the dipstick method cannot be used as a confirmation of kidney disease, but rather as a screening agent. Positive cases were recommended for clinical follow-up with complementary tests in order to further support indication of urinary abnormalities. Additionally, the dipstick test is a relatively cheap test. However, a lack of resources to fund costs for further testing is another limitation. To implement this blanket screening method, governmental funding would be required. In conclusion, early detection of asymptomatic urinary problems in school-aged children by screening tests can prevent the development and progression of kidney disease. Reducing the number of people with incurable kidney disease will help to decrease healthcare costs. Hence, screening tests on urine are important and necessary in both regards.